We're good. Well, thank you so much for continuing to stay in the telehealth track. Very excited about this next panel. Really, two pioneers and just two titans in the industry, really. So very excited to have these individuals here. Both of my prep calls with both of them, it was just incredible to learn their backgrounds, experience. We, of course, don't have a ton of time, so we can't go into all that, but this should be a very engaging a panel, and very excited to have get the guests here. So this one is capturing the consumer health zeitgeist with remote health technology, which I think is very exciting as we move forward. And again, I'm Bryan Arkwright, SCP, VP of SCP Health Innovation, also Chief Research Officer at Conv2x Health and adjunct faculty at Wake Forest. And I will let Sumit introduce himself first.
Great. Good afternoon. I'm Sumit Nagpal. I'm the GM for Health Innovation at Comcast, prior to which I've been in the healthcare industry for 25 years. I've built 5 companies, 2 of which are still in flight. And then I spent a year as the global lead for digital health at Accenture before joining my customer, Comcast.
Great. I'm Siddiqui. I'm the founder and chief medical officer of HIGI, also adjunct faculty at Johns Hopkins. Like Sumit, I've also had various career in healthcare industry for a long time, having other companies. Part of my time spent at Microsoft, running their engineering teams for the health solutions group. I'm a practicing radiologist also.
Excellent. And so with the focus being remote health technology, both of your, previous companies, founder and involved with HIGI, as well as Sumit, your role with Comcast, a major, media producer. I think that's where I was really excited to talk about remote health technology. What are kind of some of the obstacles you've encountered as a go-to market strategy for consumerism, and do you in fact see consumerism and remote health technology linked in what you're currently doing at your companies?
So, we're coming at this entire challenge of right-sizing healthcare and bringing healthcare to the right venues for the right things, for the right reasons, at the right cost, with the right experience. We're looking at this problem from a what happens in the home perspective, and what happens where we live, work, play perspective. And we're convinced that even though it's early days, that over time, more and more care is going to be delivered closer to where we live. A lot of care is going to get delivered in the home, and a lot of early warning and a check engine light kind of scenario where finding out that something's going wrong before an ambulance ride, before an emergency admission, is going to happen in the home. And so without going into too much detail around unannounced and unlaunched products, what I can say is that the home is going to become a nexus for care. People are going to want more and more care to be delivered in their homes when they're healthy. Just the way we want our groceries delivered there, we're going to want care to be delivered there as well. We're already seeing, pharmacy medications being delivered into the home on a larger and larger scale, and that's going to extend to other elements of what we define as healthcare while we're well. And over time, we're going to see a change in, the role that hospitals play in our communities, because some of the things that we go into hospitals and emergency rooms to get done, we will be able to do in the home. That's what we find exciting, and we believe that the biggest impact beyond convenience, beyond efficiency, the biggest impact that this transition can have is on the cost of care.
No, I agree with what Sumit is saying, right? I mean, for healthcare to really scale, it needs to be where you are all the time, right? So So the way we think about is that, the healthcare network really started with physician offices at home. It consolidated into hospitals and emergency rooms, which ended up being costly, which led to creation of your third network. So doctor's offices, first network, hospital, second network, urgent care facilities, third network. Now we're looking at the fourth network, which is everywhere. Home, school, work, grocery store, pharmacy, gym, you think about it, wherever you are, it needs to be. So there's applications of healthcare at home, there are applications of healthcare while you're walking around with your mobile devices, but then there's a whole area of elderly and underserved communities and low-income individuals. How do they interact? What's the bridge between it? That's where HIGI kind of comes in place, where we provide this gigantic footprint of healthcare access through a retail and at-work channel. So that's kind of how we think about it.
Excellent. And I know, when we're talking about bringing more into the home, consumerism is important. Consumerism, can be defined in a variety of ways, and hospitals, in particular, have maybe struggled with it and are just now turning to, say, oh, we need to be like more of these big tech companies, these big companies that understand consumers well. From organizations like yourselves, how have you matured along, with consumerism, and has it always been a part of your companies versus just now, whereas hospitals may seem to have just started, come on to that?
Well, for Comcast, consumers are our lifeblood.
Yeah.
We're in 30 million homes, and that represents about 83 million user relationships, consumer relationships. And so we live and breathe and get judged on that particular, our ability to deliver value in the home every single day. We think that healthcare just happens to be another service on that continuum, especially as our populations age, especially as people wind up wanting to continue living in their own homes as we live longer with chronic conditions, with long-term conditions, and we want to continue living in our own homes, surrounded by our companionship, surrounded by our possessions. We think that becomes even more important as a nexus for care. And so bringing what we have learned over very long time about how to deliver service in the home to healthcare with a very engaging, empowering consumer experience that brings joy, is really how we're thinking about the problem.
That's great. Consumer experience that brings joy. That's powerful.
So the way we think about how our thought process evolved with consumer health is when we started HIGI about 7.5, almost 8 years ago, the idea really was, how do we bring data into clinical workflows or anybody taking risk on a population? So data that is more valuable for assessing outcomes in our value-based care system, how do you bring that in, especially focused on elderly and the underserved communities and low-income folks? That was our kind of whole idea behind it. And we realized wearables immediately in 2012 when we started were not the way to scale. And that's when we thought, maybe we need to think about how banking has done it through an ATM, and can we do that? And that's how we came up with this idea of our kiosk in retail locations. The first thing we learned was that we thought we were building an ATM to decrease human interaction. And it was completely opposite of that. So one of the patients in one of our consumer research experience told me, Doc, it's like I show up at an ATM and I'm supposed to have 100,000 or 550,000 in my bank, and now that my balance is showing zero. I don't want to talk to the ATM anymore. I want to go grab somebody's neck. And so that's when I first time find out I'm hypertensive. That's the emotional reaction I get. So we've actually seen increased communication happening with retail, in pharmacy, in nutrition services, in physician communication because of that reason. And it completely changed the thought process that we need to do more interoperability, more connectivity to the local health system. So we've done a lot of partnership with local health systems, local payers, and other networks around on the whole ecosystem to really improve that interaction between the patient and whoever's taking a risk on that population. The other thing we learned was very interesting was that because we try to focus on existing habits, right? So a typical adult goes to a grocery store about 1.8 times a week, and that's exactly how we see our frequency of usage. And what we've learned now is that by focusing on that existing habit, we've been able to arriving at a grocery store or pharmacy as a trigger to get your health assessment done on HIGI. So 55% of users who use HIGI actually use HIGI before they do shopping. So now we have ability to now influence the shopping behavior and other habits that are around their chronic disease or whatever they're managing.
That's a fantastic example of really scaling consumerism and following that trait, following that cycle. I had heard some similar studies years ago around voting and tapping into people's behaviors that day. Don't just ask them if they're going to vote that day. What did they plan to do before voting? After voting, where did they plan to vote? So really associating those traits and details into their daily patterns. No, that's a great example of scaling consumerism. Is there a business model for consumerism?
Well, I think the business models are really rooted in the notion of cost takeout.
There you go.
I think one of the foundation thesis for us is that change doesn't happen in healthcare just to improve outcomes, or just to improve efficiency, or just to improve the experience. Change happens at scale when there's major shift in cost. All the other things are vital to cause adoption, but scale doesn't happen unless there's a benefit in managing to take cost out. If you can accomplish that, then you're actually getting somewhere. And so our business models are rooted in that concept. How can we bring about a fundamental large-scale shift in cost from the places where we spend money today on healthcare to spending less in places where we should be spending money? That's what our foundation premise is. And we think that the home happens to be one of those places where if we spend some there, we can wind up spending a lot less elsewhere.
100% agree. Well put.
It's a very complex question. So, especially for us, like when you think about hypertension, that's our primary disease that we focus on. You think everything is known, but we get surprised when you find out that the clinical evidence only shows when to start medication therapy on hypertension. There is no evidence how to manage it, change your medication doses, and there is no good evidence on when to discontinue that hypertension medication, right? So when I sit down with people from NIH and who are experts in hypertension management, who've been studying this for decades, they struggle with those concepts. A lot of these end up being expert opinions rather than evidence-based rules. And how do you actually handle some of these aspects or care management? So it becomes very challenging. How do you actually do that aspect of it? If you think of it, when we think about how do you scale? Like, I'll give you an example. American Heart Association every year does some kind of target in the World Hypertension Month, which is February, to hit a certain targets of hypertension screening. So this year they wanted to hit 4 million target, and they did. We hit 4.3 million target in the U.S. to screen individuals. When you look at, and what they do is they collect data from all connected devices. So any blood pressure device that is connected, any kiosk, anything that is out there, even their own primary care clinics that do screening for hypertension, they all submit data back to EHA, and that's how the global number comes in. So they looked at all connected blood pressure devices. Total 180,000 screenings were done in February on all connected health devices, all combined. Okay. There's another kiosk manufacturer that did 700,000 screenings.
Whoa.
And their clinics did 200,000 screenings.
Wow.
3.2 million were done on HIGI.
And their goal is 400,000?
4 million.
Oh, 4 million.
And 3.2 million were done on HIGI.
Whoa.
Right, so it was such a dominant aspect of how much screening we're able to do just because of focus on the consumer and how do you do that stuff, right? So So as you think about business model, as your question was, it's really hard to keep building clinics, brick and mortar, to scale hypertension management, chronic disease management for those who are not multi-morbid disease, right? Who are sick and who need continuous care. But majority of patients who are hypertensive, diabetes, obesity are walkie-talkie. Nothing's happening to them right now. There is no cost-effective, scalable manner. If you can afford devices, yes, you can do it. But the majority of population in the US makes less than 50,000 household income. They're not in that category to do this stuff. So to really come up with innovative ways, how do you engage those communities digitally, electronically, at home? Everybody has a TV, right? Everybody is using a mobile device or whatever it is to check them. That gives Comcast this opportunity to be in that, and take that moment and capture with it. And one of the things I talk about is that what do we compete with in consumer health? We don't compete with other healthcare companies or Amazon, Google, all the stuff. We compete with the McDonald's ad that is showing up, right?
Yeah.
Because there's so many. If you sit down and watch TV and just start counting how many bad habits are being advertised, and how much your eyeballs are on that, that's what we're competing with. And how much marketing dollars are spent on those things make a huge difference.
Yeah, so true. Well put. Very good answer. Got a couple other questions. I'm trying to be picky here. We talk about cost. Are you, for HIGI, are you focused on that cost of the lack of research, and that's driving the cost because there's no clear stops and starts and best practices? I guess the question is, are you razoring in on a specific cost? What are those top or most interesting costs to you guys?
So I'll give you a unique example, and we've seen a lot of the innovation coming out from our customers. We think of some idea, but then they completely take it to the next level. So Rush Health System in Chicago came to us that we are at risk for cardiac MI and stroke for homeless population that show up in the ER, about 3.5 million annually.
Wow.
Just 3.5 million on homeless people that show up in a stroke or MI, acute MI scenario, right? And he said, most common reason is these people are probably hypertensive, and or can we do something about it and do it? And so they came, what if we put these stations, HIGI stations, in homeless shelters in Chicago? Would that make a difference?
Whoa.
So it's like, well, station doesn't do anything, right? Doesn't treat anybody, just identifying somebody. What do you do? So they decided to create a resident rotation in which the residents go at night, be there. So because there's so many people coming so quickly, they use HIGI to screen the population. If there anybody that is in dire need for access, then residents do the evaluation and send them to the catchment clinic or something else where they actually take care of those patients. So they reduced their ER homeless cost from 3.5 million to 500,000 in 1 year.
Wow.
Right. So that's kind of how innovative ideas are coming out from our customers who are looking at, hey, what's our risk? Where's our risk stuck at? And how do we reduce the risk? How do you engage the consumer in the pipeline before they show up at high cost, when high cost is going to happen?
That's a great example. Was that the city of Chicago's cost, or the
That was Rush Health System's
Rush
cost.
kind of was bearing that cost?
Yes.
Because of inappropriate. Wow, that's powerful.
Yeah,
And it's great to see HIGI's focus on kind of the poor and underprivileged, and to
I
hear
mean,
you
they
continue
forced
talk
us to think
that.
about that, right?
Yeah.
We weren't thinking, we didn't know how that'll work, but they kind of proved out that you actually can do that.
That's awesome. Good.
Well, we actually share that customer, and we're doing some very interesting work with them as well. A part of what we're doing is putting a device in the home that senses things. And again, without going into too much detail, listening to our customers, listening to some of the largest health plans in the country, they're the ones bringing use cases to us about cost takeout.
Yeah.
And they're coming to us and saying, hey, if we could just listen in at night to breathing noises for little kids who are on asthma meds, who are taking inhalers, if we could just listen in and measure their respiratory rate at night while they're asleep, without them having to wear anything special, without them having to remember to wear a wearable,
That's amazing.
we could massively make a massive dent in our 2.4 million admissions a year because kids aren't either taking their meds on time or they're not using their inhalers properly. Right? If you could just find out when that happens so that the next morning either a parent is informed or retrained, or a nurse reaches into the home through telehealth, telemedicine, and recoaches, retrains somebody in the home, we could take a massive piece of that cost out.
Hey, Johnny, I love that.
It's those kinds of use cases that we're focused on. We're innovating, with Rush and others in exactly this way, with the participation of payers. We're saying, if we can do this, then there is so much savings to be enjoyed that we'll share some of the savings.
Yeah.
And that's how we're focused on this market.
So exciting. And if you were here in the morning, MUSC shared an example of some cost savings that they achieved through pediatric asthma programs as well. So it's interesting to hear that come up again. And just so great to kind of see two different types of companies that are working to cut healthcare costs. Last question, and Tori's making me ask this to everybody. So what are your predictions for healthcare over the next 2 years? And what are the barriers? And can you give us 1 to 2 strategies to overcome them?
No, you go this one.
Well, since you said 2 years, in healthcare, that's a really short time. And so I'll stretch it a bit.
There you go.
Right. I think that we're starting to see the early shades of more and more care moving into community settings, closer to where we are, and with us, where we go. We're starting to see technology, not for technology's sake, but for cost takeout's sake. As I said, with the prerequisites of easy to adopt and a great experience. With those prerequisites, nothing works without that. If people don't use it, nothing happens. But technology that meets those prerequisites, that is now all about helping us get on with our lives without thinking too much about the technology and taking cost out. That's what we see happening over the next few years. And that, we believe, is going to, 5 years from now, actually wind up becoming the foundation on top of which a new health economy is going to emerge.
So, Bryan, we always overestimate what we can do in 2 years and underestimate what we can do in five years, right? That's a famous quote that everybody talks about. I think we will be, I agree with 100% what Sumit said. I'm just going to add a little bit more to that. I think we will always be surprised where innovation comes from. I'll give you an example in medical imaging, some part of my other focus of my work. So the bread and butter, when I trained in the early days of my career, even in up till 2010, our bread and butter ultrasound examination used to be what is called trisomy screening, triple screening scans. You look for Down syndrome and other related things. This we did every single day. If you ask a radiologist today, how many trisomy ultrasound do you do, they won't remember. They'll know what it is, but they won't remember when the last time they did it because nobody's done it since 2013. What happened in 2010? Everybody was doing it. In 2013, 3 years, completely wiped out the whole imaging study we used to do routinely multiple times a day. 2010, first cell-free DNA test came out that detected it in a 2 cc blood in a lab, in the office. And by 2013, payers were reimbursing for it. Right? So now the OB can do blood draw in the clinic while the patient has arrived, and within 7 minutes have a result with 99% accuracy, 99% specificity, much better than ultrasound. And completely, everybody talks about AI is going to remove need for radiologists. It's like, hey, I have an example of, just imagine if tomorrow same thing comes out for breast screening. Your whole mammography screening industry will disappear overnight, right? So those are transformational changes that happen that just change completely something that doesn't happen anymore, right? AI will incrementally do it. Something like that will disrupt it that nobody will know it exists. And there are a bunch of different companies that have different stages of cell-free DNA for different oncological diseases. I mean, now it's going to be, do imaging to find where the cancer is and measure it for me. You can take it out because you already know what it is. Well, guess what? Machines are much better to do that than human is, right? So it's not because of AI, it's because of other things that will enable AI-related applications to be much more effective to do things that will make a difference in what is happening. So you never know. You'll be surprised. We'll all be surprised 10 years from now what actually disrupted healthcare.
Very good example, very good answer, both of yours. Well, it has been an absolute honor to meet both of you in person and collaborate with you over the last couple of months on the panel. And thank you so much for attending TMT, and thank you for being here.
Thank you, Bryan.
Thank you.
The 2019 Converge to Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology. Boehringer Ingelheim, passionately working to improve healthcare. NASCO, advancing digital health together. Forward-reaching blockchain in healthcare today and telehealth and medicine today. Special consideration to iWorker Innovations, taking the independent workforce to new heights. Connected Health Conference, designing for healthy habits and better outcomes. Haven Health Solutions, providing true blockchain transactional interoperability. Special thanks to Seaport World Trade Center for hosting us. We'll be right back after these messages. Don't go away.